Hi folks, John Adamson, the Rehab and Documentation Guru. Wow, 2 videos in one day. I'm sure you're excited. I thought I would share with you a SOAP note that I did on a patient. I don't usually do a SOAP format in a home health situation, but I thought that in this particular visit, it would flow better if I did it as a SOAP note. So I have a knee replacement patient who I'll just say is in her 70s, and she was seen by one of my assistants recently, and it had gone well for the last couple of visits, but yesterday was her last visit, and apparently she got pushed a little bit hard, and she was really painful today. And so I wrote a note, and I'm just sharing it as an idea on how to demonstrate, hopefully, the skill and value of a therapist in this particular situation. Because while she had a setback, we could still show that we're having skill involved. So anyway, this is just how I did it. It's not perfect by any means, but might give you some ideas on how you can document. So subjective. I hurt more since PT visit the other day. We should be honest, take some blame when we need to take blame if we did something that was uncomfortable to the patient. Did not get adequate sleep and had to take 2 naps today. Sleep is a function, and one of the things that we really want to do is document it as such. And in this case, the fact that this lady had to take a couple naps just to recover is evidence that this increased pain from yesterday is really impactful, and we better do something about it. Weight-bearing pain has returned. So this was a lady I documented previously that weight-bearing pain was existing at the time of eval, and she had noted that it had declined and wasn't hurting her anymore with weight-bearing, and now she's got weight-bearing pain again. So I put under objective C pain measures. So in another section on our particular EMR, we document pain. And then I started to go into my assessment. Now, what is objective, the O part of the SOAP note? Well, it's objective information. So what we did, what we measured. So I included some of my objective measurements. Assess joint play, ligament stability, I put intact. I think that's enough to convey to any therapist reading this note afterwards that everything was okay. Palpation, no significant increases in warmth noted. I probably could put, a little bit more in both. Observation, resolving bruising from surgery, incision clean and dry. Could I put more there? Sure. And then I put treatment. So what did I do in response? So here's the big thing. The patient reports a significant increase in her pain, like she has not felt since right after the surgery. I better do something about that looks different than the last visit. That's partly what your skill is doing. It shows a responsiveness that a non-skilled person could not have. So what did I do in response? And this is all consistent with her care plan. I did grade 1 AP mobilization of the femoral tibial joint, performed for several minutes at approximately 40 degrees of knee flexion, which is roughly the loose pack position of the joint. Just look up loose pack position if you're not familiar with that. I educated the patient on lymphatic drainage massage. 2B, I found a spelling mistake in my own notes, so I gotta fix that. Performed elevated by husband, so I showed her how to, guide her husband through that. Moving hands cephalically and from proximal to distal as lymphatic. I didn't do a good job with that. As lymphatic to open lymphatic drainage. So I repeated myself. That was wrong, so I'm going to take that out. Avoiding scar area. Okay. Educated patient on performance of ice massage to painful areas, as well as expected symptoms to be felt. I could elaborate more on that, perhaps. I didn't. I don't think it's a problem. Instructed patient to forego all exercises except ankle pumps, quad sets, glute sets, and gentle active range of motion. Resume exercises on Saturday. So that'll give patient a couple days of rest, and hopefully this acute inflammation will die down. Instructed patient to continue using walker to offload weight for the next day or two, because she had progressed to a cane, and now she's regressed and weight bearing bothers her, so it's just another avenue to reduce pain. So that's what I did with her today. And then analysis. Analysis is a PT or OT, and of course speech therapist. A should be your analysis, make sense of the situation. O is objective information. That's assessment. So that's how I would differentiate those two. And I just put under analysis, patient's flexion range prior to treatment was 88 degrees. Okay, that's a measure. With significant pain. After treatment, flexion was 95 degrees, and patient reported significant reduction of pain, which is an analysis that what I did that day, this particular treatment, was actually effective. And that's what we should be showing. Because part of what value-based therapy is supposed to show is progress as a result of you doing stuff. Analysis. I probably could have put this part in the SOAP, but I wanted it to flow from the treatment I actually did. I put patient felt encouraged, which she did. She told me that before I left. And education by therapy today, and I probably should put and because of reduction of pain. So I'm going to add that. Plan. Reassess acuity of pain and adjust activity, exercise, prescription accordingly. So I'm going to do something different next visit. That's another aspect of skill. I'm not a robot. I don't get programmed to do one treatment and just repeat it over time, which is a lot of how people treat knees and hips when they get done. Nobody responds to the same protocol. I don't care what clinical pathway you have. There's going to be changes between patients. So anyway, I'm reading this note. I can see things I could have done better in it. Perhaps you could see them too. So feel free to comment, make suggestions about how I could have done this better. But anyway, that's just an idea of how you might demonstrate skill on a daily basis when working with your patient. Anyway, I hope you're having a great day. Take care and God bless.